Today we'll discuss about the resin bonding agents. We'll go through few terminologies before it is that cohesion and adhesion. Cohesion is the bond between the two like substances, whereas adhesion is the bond between the two unlike substances. Then we'll see what is adhesive and what is adherent is. Adhesive refers to the bonding agent that is when applied to the surface of the substance can join them together, which will resist the separation too. Whereas adherent refers to the surface or the substrate that is adhered to. We'll go through the bonding mechanisms of the dentin bonding agents. It has mechanical bonding by penetration of the resin and formation of the resin tags within the tooth surface. And the diffusion refers to the precipitation of the substance on the tooth surface to which the resin monomers can bond mechanically or chemically. Whereas chemical bonding occurs by the primary valence electrons such as the ionic, covalent and the metallic bonds. Whereas secondary valence electrons will also provide the van der Waals forces as well as the hydrogen bonding. Now we'll observe the factors which affect the adhesion. The first factor is the surface energy. If you observe, the surface energy has the surface energy increased by the increasing the surface area. If you observe in the picture also, there is a greater increase in the surface energy if there is a more contact angle, that is a more surface available for the substrate. Now we'll see other factors such as the wetting and the contact angle. The angle between the adhesive or the adherent is called contact angle. Smaller the contact angle, better the wettability is. If you observe in the picture, that is a round circle attaching to the tough surface, it is 180 degrees contact angle, which is not acceptable. Whereas 0 to 180 degrees has a poor wetting and the 0 degrees has the perfect wetting. Now we'll observe the microstructure of the dentin. Coming to its chemical composition, by the weight it has 65% of the inorganic, 20% of the organic and 15% of the water content. Whereas by the volume it has 45% of the inorganic, 33% of the organic and 22% of the water content presence in it. So being the dentin, the dynamic tissue, it has few challenges in it. That is, it shows some changes due to the aging and having the considerable amount of the organic material and the water, and it also has a dentinal fluid with a constant flow outward from the pulp. And the dentin being closer to the pulp, so different chemicals used in etching and dentin bonding may irritate the pulp. So therefore, since dentin is inherently a hydrophilic tissue, bonding of hydrophobic resins to this substrate is a challenge. Now we'll see the components of the dentin bonding agents. What is present in it? First one is the etchant. Next we'll see the primer. Next is the dentin bonding agents, that is adhesives. Next is the initiators and accelerators with few fill-up particles added in it. Now we'll study about etchants. The first acid etching concept was introduced by the Bernoulli in 1955. Since then, a predictable means of achieving adhesion between adhesive resins and tooth structure occurred. So etchant will clean the enamel and removes the smear layer, creating the micropores by removal of the enamel, thereby increasing the surface energy. And for etching the tooth surface, we require the 37% of the phosphoric acid. If you observe what is the etching time preferred is, that is about 15 to 30 seconds for the normal tooth, whereas for the children's it is about 45 to 60 seconds due to the presence of the aprismatic enamel, whereas for the fluoride teeth it's about 60 to 90 seconds. Now we can learn about the mechanism of the etchant. The enamel agent microscopically observes the three patterns. Type 1 is the dissolution of the prism cores, leaving the prism peripheries intact, which gives the honeycomb appearance on microscope. The type 2 is the dissolution of the prism peripheries, leaving the prism cores intact. It gives the appearance of the cobblestone that can be clearly observed in the microscope. Type 3 is that no prism structures are evident, neither the prism cores nor the prism peripheries. There is a mixed pattern of the type 1 and the type 2. Now we'll go into the primers. The primers are adhesion promoters, so they have the hydrophilic groups bonding to the dentin and hydrophobic groups bonding to the adhesive resins. And they facilitate the wetting of the dentin surface. They're usually dissolved in solvents like acetone, ethanol, or water. So they displace the water from the dentin surface and the moist collagen network. This will allow the monomers of the primer to infiltrate through the spaces in the collagen network. So the priming step converts the hydrophilic dentin into hydrophobic and spongy state for penetration by adhesive resin. Now we'll observe what is an adhesive is. This is the third component of the dentin bonding systems and it's primarily composed of hydrophobic monomers like bis-GMA, UDMA and diluents like TEC-DMA to lower the viscosity, and HEMA has the wetting agent. It will flow onto the conditioned and the primed tooth surface to form the resin tags and the hybrid layer. Now we'll see the classification of the dentin bonding agents. The first generation of the dentin bonding agents includes the NPG-GMA, a surface active comonomer. Theoretically, if you see, the NPG-GMA was supposed to chelate with the calcium in dentin to form a water-resistant chemical bond to the dentin. But the bond strength produced by this agent is very low, that is about 2 to 3 megapascals. So clinically, this agent did not successfully bond the composite resin to the dentin. And the commercially available product is Servident by SS White Company. Now we'll read about the second generation dentin adhesives. In an attempt to bond chemically to either organic component of the dentin by the isocyanate and the carboxylic acid group and to the inorganic component of the dentin by the phosphate group and the amino group, they affect the bond to the calcium or the collagen of the dentin. If you observe, the commercial product is that the Clearfill bond system F, bond light and Scotch bond. The clinical application did not succeed due to the lack of hydrolytic stability, and also they primarily bonded to the smear layer and did not to the underlying dentin. However, they have the limited bond strength of 5 to 6 megapascals. Now we'll observe the third generation dental adhesives. They attempted to deal with smear layer as well as with the dentinal fluid. The idea was to avoid the aggressive etching of the dentin because of the concerns that acid etching of the dentin can cause a pulpal inflammation. The third generation dental adhesives uses the milder acids like 2% nitric acid, 2.5% of malic acid with HEMA products. The commercially available products such as the Tenure, Scotch Bond 2 and CNB Metabond. However, the bonding strength of this third generation is also very limited. Coming to the smear layer. The smear layer is nothing but the layer of a debris or the bacteria that is attached to the surface after instrumentation. The loosely attached smear layer consists of 1 to 5 microns, whereas the smear plugs is that occlude the dentinal tubules. They extend up to 10 microns. So the third generation dentin bonding agents will help in modification of the smear layer to improve its properties or to remove the smear layer without disturbing the smear plugs that occlude the dentinal tubules. Now we'll study about the fourth generation dentin bonding agents, and here the multi-step treatment of the dentin is done, that is totally based on total etch concept. Here, the primarily the acid etching step was done with the help of 37% of phosphoric acid for 15 seconds, and the primer step is the second step which will act on the dentinal surface moist so has to prevent the collapse of exposed collagen network. And next is the adhesive with the contains the BIS-GMA, UDMA, TEC-DMA, and HEMA will act on the tooth surface. Later on, the composite resin is placed. The unique feature of this fourth generation is that it will have the total etch concept and the moist bonding technique. If you observe the commercial products available for this is the Scotch Bond Multipurpose All Bond 2 and the Panavia 21, which is by the J. Morita company. So, coming to the bond strength of the fourth generation is better than the first, second, and the third generation. Now we'll go to the hybrid layer. The hybrid layer is also known as the resin dentin interdiffusion zone, and the hybrid layer was introduced by Nakabayashi. If you see, this layer is formed by the interdiffusion of the low viscosity monomers into the exposed collagen network and the intertubular dentin to form the micromechanical bond with the dentin. And coming to the zones of the hybrid layer, we have the three zones. That is the topmost layer, which consists of the loosely arranged collagen fibrils with the interfibrillar spaces filled with the adhesive resin. The mid zone consists of the collagen fibrils infiltrated with adhesive resin along with some residual hydroxyapatite crystals scattered between the collagen. And the bottom zone is the gradual or the abrupt transition to the underlying unaltered dentin with partial demineralization. This zone gives the shark carpet appearance, that is the loosely arranged collagen fibrils. Now we'll see the ghost hybrid layer. This occurs due to the incorporation of the air bubbles at substrate and the resin infiltrant. And the reverse hybrid layer is the hybrid layer surrounded by more of the inorganic material. Next is the tubular hybrid layer is the extension of the hybrid layer into the tubular wall of the dentin. Next we'll see the lateral tubular hybrid layer. It is the extension of the hybrid layer into the walls of the lateral tubular branches. This is about the different hybrid layer concepts. Now